is going over here into the right side. Okay, it's coming out of the ventricle, bypassing the valve, so I know that's my pulmonary trunk. Okay, the next one, when I stick it in here like this, and we open it up, it's into the ventricle. It goes into the ventricle, and here's the valve. So blood that went from the atrium into the ventricle goes across this valve. This probe doesn't go across the valve, right? So this is the aorta. This is where the blood's going to shoot out once we squeeze this side of the heart. Okay? So we've got the pulmonary trunk, the first one. Okay? We'll take it out. Then we've got the aorta. Now, if you look at the way it's arranged, this side of the heart and this side of the heart. This side of the heart versus this side. So this side, okay, is running this direction. We open it up. We're looking at the left side. Over here, when we open it up, there's our probe in the left atrium, right? So we know this side has got to be pulmonary veins coming back into the atrium. These that are in like this have to be our superior and inferior vena cava, so they're setting in the heart more like this. Remember, the heart's at a slant like this, so that actually looks correct anatomically. Okay? So, right side of the heart, this is on the right side of the heart. We know we're superior, inferior vena cava. This is on the left side of the heart. We know we're both pulmonary veins coming back in. Okay? So that's the major vessels coming in. On the outside, we can see the auricles. Okay? When we look, we also see the sulcus that carries the veins and the arteries in it. It's got that little fat part to it. See the apex, the base. Then when we open it up, okay, we've got it set correctly on this one, where this is the right side of the heart, the low pressure side, because we can see the thickness is small. We know this is the high pressure side because it's very big. We can see this piece that runs in between it. This is the
interventricular septum.
Interventricular septum that separates our two ventricles. When we look, here's the valve and here's the chordae tendineae that attach to the valve. So everything below this valve is ventricle. Okay? We don't see the ventricle, we don't see the valve very well unless we pull on it a little bit, and that's going to be kind of up here above my finger. So it's going to be more up in here. While we're here, and we have this open, we can see that pretty moderator band in this one. That part right there is the moderator band. Remember, that carries the electrical impulse that's making its way down the interventricular septum. It communicates with this side of the heart, so that we get a nice squeezing of the heart that way.
Will you ask that on the first one?
Yeah, I can ask you that one. So, on this side, this valve is the right atrioventricular valve. This valve over here, and this valve over here, which is the same valve, is the mitral valve. I don't like it, but you can call it the bicuspid valve, or the left atrioventricular valve, right? Above the valve is the atrium. In this case, it would be the left atrium over here, and we actually see part of that ridges that we talk about, okay, in the atrium. If we trace the blood out of the ventricle, it runs into this aorta. And see this little flap right here? This is our aortic semilunar valve, right here. You don't get much of it on this side.
Oh, I'm so sorry.
Yes, a little bit.
The pulmonary semilunar.
Don't see the pulmonary semilunar because I don't have a good cut for that
Okay.
part. I'll see if we can find it on a different one. Here's a good papillary muscle leading to the chordae tendineae, so that little bitty bump where it's myometrium. That's good. We can have the outside of the heart is the pericardium, so it's the visceral pericardium or the epicardium. Then we have the myocardium, which is all this muscle. And then the part where the blood actually is touching
Endocardium.
is the endocardium. Okay? So let me see if we can find a good pulmonary cut. Here's our semilunar valve again in the aorta. But I don't see a good pulmonary cut on that one. This one has potential. That's part of part of the pulmonary semilunar, right there. So all the valves are basically right along in this area right
So
here.
the pulmonary is gonna sit up higher than the aorta?
Well, this one I don't see it good.
Because I thought sticking the probe in it, hell yeah, totally different.
Well, this is aortic coming out right here.
Mm-hmm.
Okay. So I said that was pulmonary. That's aortic, excuse me. I said the wrong one. The pulmonary, I think, is this one right here. That part right here that would go across.
So the pulmonary is gonna sit in the right.
Mhm. My bad.
So
That
the
was-
aorta is gonna sit in the middle.
Mhm. Yeah, because I don't see it up in here. So that's a hard one to find too. The aortic is much easier to find than the pulmonary one, just because of the way we
I think
typically
you should
cut it.
just use the little mannequin things.
I agree.
Well, we'll see. That's good.